Hi, Kendra, my friend. Thank you for joining the podcast. I am really excited to talk to you, and I have to share with the audience that you and I have been friends since we were itty bitty,
Yes,
itty
very
bitty
itty bitty.
kids. Yes, and it's just such a amazing moment right now for me to be talking to you about the work that you do. I love the fact that we have both kind of carved out spaces in the areas of healing and mental health. And
Yes.
so I'm just very important. It's a very important conversation. I'm very excited to be chatting with you today. So I'm going to bounce it to you just to
Yes.
give us an introduction, who you are, what you do, and the impact you're looking to make on the world.
Awesome. Thank you so much. I'm so excited to be here. It's very surreal to sit here and like, I feel like I'm seeing 2-year-old Angela. And then now it's like, here you are. Like, it's
It's
amazing. So,
wild.
it's pretty cool that we're able to do this together and on this platform. So thank you for the opportunity. But yeah, so my name is Kendra Vargas. I'm a psychotherapist, certified perinatal mental health professional. And I have a telehealth practice here in Illinois called Authentically Psychotherapy, which was recently launched this year. But I've been in the world of private practice for about 5 or 6 years, and then worked in community mental health and hospital outpatient clinics. But right now, a lot of my focus is working with the perinatal population, people struggling to conceive, people with postpartum depression or just trying to navigate, parenthood or transitions through all that, through the whole process. So that's a lot of where my support is, as well as just general mental health as well, like anxiety and depression outside of the perinatal world. But a big focus is, and passion, personal passion, is the perinatal world. For me, it's something I've had personal experience with infertility, and it led me down this path of wanting to help others and give support and kind of use my platform and as a therapist, to be able to get certified in this area, and find different ways to help. So the goal is to spread knowledge, break stigmas, start conversations, educate, and whatever way that is, whatever platform that is, whether it's in a one-on-one session, whether it's in group therapy, whether it's on Instagram, whether it's through things like this, through a podcast. I think, the benefit of our field is like we can give help and give information and provide that to people in so many different ways, even though we're trained to, in a very specific setting, but there's so much more that we can do. So I really just hope to keep breaking the stigma of mental health. And especially when I think about like the Black and Brown communities, there's a lot of disparities, and, the numbers are alarming. So I think the more we can have these conversations and talk about it, I think the better.
Yeah, absolutely. And the reason why I was, other than you're a good friend of mine and really value your knowledge and opinion on this topic, was because I don't think a lot of people know what perinatal even
Yeah.
means. I
Yeah.
don't think that organizations and workplaces understand the experience from people who are able to conceive, but also
Yeah.
people who are, experiencing
Right.
this. And work is something that takes up a lot of our lives. So how can we make sure that we understand this part of the human experience? So let's start
Absolutely.
there. Tell
Yeah.
us more about what perinatal
Yeah.
means, and from a
Yeah.
mental health perspective, the implications.
Yeah. So perinatal, basically that period is from pregnancy to postpartum. So anything from trying to conceive, getting pregnant, hopefully, right? And then that pregnancy period, once you have the baby, and then a year after postpartum is that period. So those are really crucial times, and the times where perinatal mood and anxiety disorders can show up. And it's very common. 1 in 5 women have a perinatal mood and anxiety disorder, and I believe it's 1 in 10 men. So I think we tend to forget about the dad sometimes when we're talking about this, but paternal mental health is just as important. So yeah, it's basically anything in that period. So someone trying to conceive, if there's any struggles there, there's a lot of things that can start to come up, and that can be difficult to manage, where jobs can come in and play a big role in that and how to support people through those periods.
Yeah, and what's I mean, and I know these are kind of basic questions, but
Yeah.
what are the causes other than the obvious like big life
Yeah.
change or not
Yeah.
being able to conceive? Are there any like causes or drivers of this experience for people?
I think it kind of goes back to basically like with mental health, there can be a genetic component, a psychological component, environmental. But I think, speaking even from personal experience, going through fertility treatments and not knowing if it's going to work, or, if you're ever going to get to that end goal, the stress of that, how much that impacts you. And then if you think about while you're going through all of these things and trying to conceive and coming up through all these different, complications or whatever the case is, then you have work to worry about, trying to get to work on time and trying to make sure you're not missing, and dropping the ball there. So there's a lot of things that can contribute to the stress that's already there, just with the basics of trying to conceive.
Yeah, and I just want to also acknowledge the fact that for people who can conceive in particular, who
Yeah.
are trying to conceive, you
Yeah.
also have the additional stressor of how the workplace is going to react to once you
Yes.
get to that goal. So
Yes.
not only do you have the stress of trying to figure out if you can conceive,
Yeah.
and then having to worry about the system and how the system treats people who are having to go on
Yes.
maternity leave.
Yeah.
So that's just another factor that has to be an added stressor on top of just trying to make a
Absolutely.
life decision and wondering if that life decision can actually come true.
Absolutely. And everybody's journey is so different, and people experience pregnancy in such different ways, right? Not everybody's like glowing and just feeling so wonderful and, feeling so beautiful. And not everyone goes through that. Or even after they have the baby, people may come back to work. I think I often find people have a hard time when they return, and people ask, "Oh my gosh, how are you? How's your baby?" And they don't give the typical response of what you expect. It's hard. I'm sad. I don't know what I'm doing. I like, and then people don't know how to respond to that. But if there's a culture where that's already set in place, where like you can have those conversations, right? And that's a lot of, I think, what we will get into is just having a culture where that allows that, and not to come in feeling like awkward to talk about those experiences.
Yeah, I mean, let's talk about that. It's I've talked to so many women who, and I don't have kids myself. I haven't
Mm-hmm.
been through the experience, but
Mm-hmm.
I've just had some really real conversations with people who have had
Yeah.
children, and they're like, you
Yeah.
know what, when the baby was in my arms, I just passed it off. I was so sad and just like overwhelmed. I didn't have that moment of like I'm
Right.
glowing and this is wonderful. And I think I think we also have to realize that from a workplace perspective and a societal perspective,
Yes.
we're putting a lot of pressure to behave a certain way, which is not everyone's experience either.
Exactly. Yeah, there's a lot of different factors, contributing factors to why that experience might not look like what we expect it to look like, or we may not be following things the way society says we should. A big one is, yeah, the reaction that you have when you have a baby. Everyone expects there to be this huge level of excitement, and or the reaction to the choice of whether to breastfeed or not breastfeed,
Mm-hmm.
right? And the pressure that society puts on, breast is best, and maybe you're
Mm-hmm.
struggling with that, or maybe that's not anything you're really interested in doing. I mean, there's so many different pieces to it that can add on to that stress, as you're already trying to navigate parenting at that point and this new child in your life. Yeah.
Yeah, absolutely. And so, how do you think? Let's start with how do you think workplaces are failing to acknowledge this experience?
Well, that's layered.
Yes.
I think, employers, they should have a duty of care to their staff, right? Like,
Mm-hmm.
and, I know you talk a lot about workplace culture and what that should look like. And I don't think employers are creating environments where this information is being discussed or these topics are coming up, or, I don't think, I think it tends to people kind of step away from it or don't want to get involved. Like employers kind of take the back seat, like, oh, I'm going to, they're doing that. They told us, great. Okay. And we're going to kind of put our hands up, and they're focused more on, when are you going to return? What does this look like for the company? Are you going to still be meeting your deadlines? I mean, just the pressure. It's like, when are you coming back from maternity leave? Right. It's, which I get it from the employer side, like that's important. But how about a check-in, right? Like a simple check-in. How are you doing with all of this, right? Like, I think they're just missing the ball, and like the communication from the employers to the employee aren't happening. And then I think they can do a better job with informing staff, or, how, whether it's sending out emails of, National Infertility Awareness Week, or, paternal dad depression, or, just things, information. I just think we just kind of take the back seat. And that's a
Yeah.
problem. Mm-hmm.
Yeah. And I think, you talk about just like general benefits, right? And who are they benefiting, and things
Right.
like that. But,
Right.
I think one of the things that is really important is making sure you have a paternity leave policy, not just a
Yeah.
maternity leave policy, because if you
Yes.
can imagine, the person who is conceiving or having the baby obviously needs a
Yep.
lot of support,
Yep.
regardless of who that is.
Yep.
And if that person has a partner,
Right.
there needs to be some inclusivity around
Yes.
ensuring that support is within the home,
Yes.
and making it okay, and role modeling. That's the other thing. I've seen
Yes.
way too many organizations that have maybe a paternity
Mm-hmm.
policy,
Yeah.
but your CEO isn't taking it. Your
Right.
executive team isn't taking it because,
Absolutely.
oh, that's not, I have a wife at home who, is able to take care of the baby. She's good. Like,
Right.
that's,
Right. Right.
you have to role model these
So,
behaviors for people to,
absolutely.
and kind of disrupt the status quo a little bit.
Absolutely.
Yeah. But also
Absolutely.
I think, if you think about like baby showers, like there's always this like celebratory, and this should be something to
Mm-hmm.
celebrate. But I think that, when life changes happen, I think it really has to be on the terms of the person who's experiencing it.
Yes.
You may be having a really, traumatic and challenging pregnancy. So,
Mm-hmm.
if everyone's gonna be like, oh, we're gonna be throwing you a baby shower, or, it just
Absolutely.
may not be, read the room, it may not be the
Yes.
right time.
Yes. Yes.
And so you can't read the room unless you talk to people and check in with them.
Exactly. And I think anytime you just ask, is this something, here's what we'd love to do for you, but
Yes.
we want this to be your choice. What do you feel comfortable with, right? Like, what do you need? Because, yeah, sometimes just the thought of a baby shower is overwhelming because there's so much anxiety about being pregnant, or there's already
Mm.
signs of depression that are starting, and they just can't get that feeling of joy and excitement, and then to have the guilt and shame for not feeling that, but everyone around them is feeling it, right? There's so many layers of things that are happening in that moment. So yeah, I think if employers could just do a better job of checking in, asking what they need, what do they want things to look like, and how can we support you, and not having that conversation just one time. It's more than once. It's constant, and I think again, it's just having that supportive, inclusive culture. If you already have that in place and the communication is already there and people already feel comfortable going to their employers about these things, um, or recognizing that people may not want to share and respecting that as well, and still being able to offer support, I think we'd be in a better position where people can feel a little less stressed when having to walk into the door at work.
Mm. Yeah, and I think the realization that, perinatal is really just, from my understanding, kind of this full span, end to end, of
Mm-hmm.
this experience of this huge life change.
Mm-hmm.
From trying to conceive to even the post,
Yep.
experience. And so, talk a little bit about that post experience,
Yeah.
and what that could be like.
Yeah. So, when I work with my perinatal clients, after they have a baby, I make sure to check in with them, especially that first month. The first 2 weeks, I always educate people. Like, most people experience the baby blues those first 2 weeks. You're just a little off. You're a little weepy, right? Someone might say something and you just might start crying. And I went through it. I remember that feeling.
Mm.
And so it's good, for people to know to expect that, for their partners to expect that. But once we get past that 2 week period, if we're still seeing signs of, not feeling connected to the baby, or, very like obsessive thinking, like constantly checking in on the baby, right? Like the stress of that, or not being able to sleep at night. Let's face it, there's not a lot of sleeping at that time, but not being able to sleep for reasons because, you're in this like obsessive, thinking that won't stop, and you're just ruminating in your thoughts. And, there's a lot of things that can happen. And so usually after those first 2 weeks, we know people are going to be, again, a little off, a little different. But if it continues on past that 2 weeks, that's where we check in and see, like, let's make sure we keep talking about it. Let's make sure your supports are in place. Let's make sure our meds needed. Like, there's a lot of different things that can come into place for that. Yeah.
And, I would think from a workplace perspective, I think about maternity leave or paternity leave. And what are your thoughts on the length of time that is typical?
Don't even get me started on that's a whole nother podcast. It's horrible. We have it so wrong here. It's so wrong. I have friends that live in other countries and just have like the most beautiful experience, like in terms of having 6 months off, or even a year, or, leaving the hospital with no hospital bills. And, it's just, there's so many things that we just unfortunately don't have right here. So yeah, sure, we can get 12 weeks, if that. And, it's frustrating. I have to check myself sometimes when I have my clients who are like, I know I get my 12 weeks, but I'm probably thinking like probably about 5 or 6 weeks I should go back. And I'm just like, no, no, don't take the time, but when someone's very, and focused on their business, I get that. And I have to recognize that too, right? And recognize that's my stuff too. But your baby is just maybe might be sleeping a little bit more at 12 weeks, right? Like maybe. I remember going back to work, checking the video cam, while I'm like sitting at my office pumping, and feeling so tired because sure, she gave me 2 nights of like a 5-hour streak, but then it was like up every 2 hours, right? And then here you are, you have to go back to work and try to focus. Like, it's ridiculous. It's ridiculous. And paternal, it's getting better, but a lot of people, it's still pretty much non-existent, or you don't get paid, right? I didn't get paid on my maternity leave. I didn't get a single dollar. So the stress, right? The financial stress. And that's the thing. I understand. I think employers, if they are unable to provide those types of benefits, like paid time off, maternity leave, paternity leave, things like that, there's more though that you can do. Like, I get it. It's up to the company. It's up to the business. Thankfully, we live in Illinois, where there are a lot of benefits of living here, especially like people going through fertility treatments. We're one of, I think it's 18 states that are mandated to give some sort of fertility coverage. Again, it's up to the employers and the businesses, but there's usually something here. That's a lot of people come here to go through like their treatments, but there's just a lot. There's a lot that can be done better in terms of the leaves and what's provided on those leaves, whether they're paid, unpaid. Yeah, we could do better.
Yeah. Oh, absolutely. And I agree with you 100%. Just hearing you talk about the length of time, and it's not just about, because we call it a disability when we,
Right.
When we record this, right? And we think about it as like a temporary disability, and it's physical. And I think that's what usually guides the amount of time. When what I'm hearing from this conversation, and I agree, is that it is also mental, and it's also a part of mental health. And if you are an organization who is preaching wellness and mental health and trying to do better, think about the full experience for both parents going through this process. And then the added stress of just this life transition, not just having the baby, but life transition, and what that actually does to your attention span, to your ability to sleep. I would recommend, obviously, I would advocate for more time. Like, if you have a maternity or paternity leave policy, add more time to it. Please, because your people need it, and they're probably not even being as productive as you think they are because they're internally struggling. and it's not sustainable for either parent,
Right. Right.
especially a single parent. Think about a single parent, right?
Right. Right.
I think the other piece is, even if you can't reduce the amount of time, I think you can provide some equitable transition
Yep.
options,
Hmm.
flexibility options for the new parent. And that might
Yes.
mean, you're going to be part time for 10 more
Yes.
weeks, or give that option, or you can do, 4 10s, or, I think there has
Yes.
to be something else that follows it, because it needs to be a transition back to reintegrate into work with this new life change that's happened to you.
Absolutely. And I think it starts, if you're looking back at someone trying to conceive, my area of focus and specialty is in fertility treatment. So a lot of times I'm helping people figure out ways to communicate to their employers how much flexibility they need, because you have to go in the morning for appointments. You have to give yourself shots, right? So trying to get to work on time when you have to go to the fertility office to get your blood work drawn, get to work, make sure you get your shots done because there's a time frame, right? There's so much. It's such a fast
Mm.
moving day. So, and then there's side effects, right? So, and then there's financial, right?
Yes.
If you don't, your insurance doesn't cover fertility treatments and you're paying $15,000, right? There's just layers. And I always say that the layers to this stuff it's heavy, and it gets heavy and people feel that heaviness. And so I think if employers can understand, okay, great, we're requiring, like I have a client right now, they're requiring them to come back in the office 3 days a week. And she just had a loss. She had a failed transfer, and now she's trying to go through another fertility treatment, and she's more stressed. She recently got on medication because her anxiety just got to be so much, and she's got a very important role in her job, and she just felt the pressure. And I said, let's put something together and put some requests together, right? Her doctor, we're all coordinating to support this person because it's a lot right now. So she's like, I can make it in 1 day a week, I can do that, but I can't do three. I know I can't, right? And I know I'm doing my work well at home, but like I just can't, so sometimes it's just starting even from that point on. And then
Mm-hmm.
throughout, I've had people extend their accommodations to whatever extent they're getting into the pregnancy, and then postpartum too, into once the baby comes. Like sometimes, and companies are getting better. I will say they a lot of, from what I'm experiencing, they are starting to get a lot better with the flexibility and understanding scheduling, and just not adding more and trying to help remove things opposed to adding more.
Mm-hmm.
So we're getting there. But I think if employers can just be supportive in that way and be flexible, what would it look like for you to
Mm-hmm.
not feel this stress anymore? What is there anything we can do on our end? And let us know. If it's a no, then maybe it's a no, but maybe there's something else we can do. Like we can figure this out. And think they just
Mm-hmm.
have to be more flexible in that way.
Yeah, and I think this, just having this information and I think when we thought about maternity leave, or we thought about flexibility, we didn't think about the concept of fertility treatment. We thought about, well, yeah, of
Right.
course, you're someone with a uterus who can have a baby. You're
Right.
at childbearing age, you're going to have a baby, right? And that's it. And it's
Mm-hmm.
like, well, no, there's a lot of
Mm-hmm.
people who can do not have that luxury,
Right.
and
Right.
they additional intervention is needed, and
Right.
it's painful. It messes with your hormones.
All of
It
it.
requires appointments like every week. Imagine what that can do to a person who is
Right.
already trying to work a full-time job,
Exactly.
trying to manage all these things. So I always talk about like leaning on choice for people. And that's why I
Yes.
feel like, people who are asking, employers who are asking people to come back to the office arbitrarily,
Mm-hmm.
um, just think about all these different scenarios, all these things that are happening in people's lives. It could be fertility treatment, but it
Mm-hmm.
could also be a sick parent. It could be that they're
Mm-hmm.
caregiving for a sick relative. It could be that they have mental health issues. So
Exactly.
all of those things can be not solved, but can be alleviated if workplaces would just give people choice and flexibility. And so if you're listening
Absolutely.
to this and you're not giving flexibility,
Mm-hmm.
ask why. Like why is the paradigm still kind of in your head that needs to happen? Because usually when you give people flexibility, they are able to manage their time in a way
Right.
to still meet all the different goals in their life,
Right.
including work, but
Right.
including maybe trying to have a baby, right?
Right. Yep.
So how
Yeah.
can I want to kind of close today with because there's going to be people, there's going to be employers listening, leaders, people who
Yeah.
like have decision making power to
Right.
make these decisions, but also people who are listening who are like, oh my gosh, I'm going through this right now. How can I
Mm-hmm.
advocate for
Mm-hmm.
myself? So, what
Mm-hmm.
recommendations do you have for those folks who want to advocate
Yeah.
their perinatal journey?
Yeah. Well, I think from an employer standpoint, you have to remember you have a duty, right? Like, and I
Mm-hmm.
think you have to remember, I think it's important to look at your policies that are in place right now and recognizing, are there any policies that we have in place that can be adding to the stress of people who might be going through these experiences? Absence policy, right? Mandate
Mm-hmm.
policy of scheduling, right? All those kind of things. I mean, employers should constantly be reviewing their policies and hopefully making changes to them. So I think that's a big part of, for on the employer side, is the flexibility, looking into your policies, your benefits. Is there any room, right? Is there any room
Mm-hmm.
to make some changes and some edits? And I think on the employee side, there's a lot of, I think, just communicate, have that communication. Again, hopefully on the employer side, they've created a culture where it's inclusive. There's room for conversations. There's, not things going on where, you're being, your role is going to change because you spoke up about something. I mean,
Mm-hmm.
hopefully it's not a toxic workplace where you can have these conversations. But I think being able to write down, making a list of things that you need, whether you feel like you need to work from home occasionally, or you might not be able to make this one meeting, that, whatever it is, I think I'd encourage people to sit down and wherever they are in their treatment
Mm-hmm.
process or in their pregnancy, and look at, what do I need? What would be helpful for me when I think about work? Is there anything that's adding to the stress of work? Is there anything
Mm-hmm.
that would, if it were eliminated, that it would help me and help me not feel this stress or this anxiety? Um, and communicate it. Again, I think people are so afraid to communicate because they're afraid of hearing no, or no, we can't do
Mm-hmm.
that. But no doesn't mean just no in that sense, right? Okay, what can we do? What are some other
Mm-hmm.
options? So I just encourage people to talk to them, or use your resources too. If you have a OB-GYN who you trust, or a therapist that you see, they can help advocate and help you through that process too.
Yeah, and I would just also advocate that stress impacts the ability to conceive. So,
Absolutely.
this is also about kind of this perpetual cycle of sustainability and the humans you're employing within your workplace. And
Right.
if you're causing additional stress, you're probably making it not only harder on the person, but
Mhm.
also they're going to have to continue to get fertility treatments because they can't get into a state where
Right.
their bodies are even ready. So,
Right.
um, yeah, I really appreciate you telling us more about this really important topic, this experience that many people are having within your workplaces right now.
Yeah.
And I think your advice on reviewing your policies, ensuring that there's flexibility and choice, and just some tips for people to advocate for themselves,
Yeah.
because sometimes, there is a lack of awareness around this experience.
Absolutely.
So
And I always tell
I
people,
really,
wave a magic wand. What would it look like, right? The magic wand miracle
yes.
question. If you didn't have any of this, what would that feel like? What would it look like, right? What, going into work, what would that look like for you if you didn't have to worry about any of these things? Okay, so how do we, let's break that down and see if there's anything we can do to help implement some of that stuff. You never know. So yeah,
Absolutely. And it never
yeah,
hurt to ask. And if you
right,
are in a position where you feel unsafe to ask because you think
right.
your job is going to be at risk, you're probably in the wrong place.
Yes.
So,
I was going to say that too, but I didn't know how much, might be time to reconsider the
yes,
position or the
yes.
company. That's sometimes is an option too.
Yeah,
Yeah.
and I truly believe that and say that to people because,
Yeah.
yeah, if you can't have an open conversation about a life decision that you think is going to impact you because
Right.
someone is going to think you're not going to be able to be as valuable, like you're in the wrong place. You're absolutely in the wrong
Absolutely.
place. So, Kendra, I absolutely love this conversation. We will be
Yay.
sure to put your information in the show notes so that people
Okay.
can find you if they are in this position, if they're having this experience, or if you're an employer who wants to offer
Yeah.
some of these services to your people.
Yeah.
Kendra would be a wonderful resource, um, for a program like that. So we're going to include that in the show notes. And
Awesome.
then tell us just how we can find you.
Sure. Yeah. Yeah. So
Mhm.
the website for the practice Authentically You Psychotherapy is aypsych.com. I also have an Instagram for the business, which is AU Psychotherapy. That's AYOU Psychotherapy. And then if anyone has questions or wants information on anything at all, my email is kendra at aypsych.com.
Wonderful. Well, Kendra, thank you so much. Really appreciate your insight and would be
Thank
happy to have you
you.
back on the podcast anytime.
Yes, thank you
Uh,
so much. This is really important. And I hope, even if one person is able to walk away today and feel empowered to have a conversation or make a change, I think that's why we do the work we do, right?